My name is Michael Battelle. I'm the president and founder of the Fatty Liver Alliance. We raise awareness about the risks, causes, and complications of fatty liver disease and help those already diagnosed with MASLD and MASH by advocating for access to approved treatments and care. Our very special guest today is Dr. Meena Bonsal, an internationally recognized hepatologist and professor of medicine at the Mount Sinai Hospital in New York. She's Assistant Chief Division of Liver Diseases for the Mount Sinai Health System. She's also served as the principal investigator for numerous clinical trials for MASH and makes her the perfect person to speak with today for part 3 of our 10-part Liver Insights 2 series. We're going to be speaking with her about MASLD and MASH symptoms and what they really mean. So, Dr. Bonsal, patients often struggle to link the symptoms that they're feeling that they attribute to their liver health. And we hear very often that liver diseases like MASLD and MASH are silent. Are they really silent, or is there more happening that we all really need to understand?
I mean, I think that's a patient by patient kind of perspective in the sense that for some people, they it may be silent, but for others, it's not, right? So I think that certainly there are symptoms that one could attribute to having steatotic liver disease or MASLD. I think part of the challenge is some of the symptoms are very non-specific. So it's hard for someone to say this is definitely related to your liver. You could say, okay, maybe it's related to your liver, but it may be related to your diabetes, particularly if that's not controlled. It could be related to if you have hypothyroidism. You know, there's so many comorbidities with this disease that sometimes it's hard to pinpoint exactly what's driving the symptom. There's no denying that there's symptoms, right? There's symptoms. It's just kind of pinpointing exactly as what's the main driver of that symptom can be a little bit challenging. I
Okay.
think, yeah, go ahead.
Oh, no. So I was just sorry, I didn't mean to interrupt you, but I was going to say what you said is incredibly important because we all recognize now the metabolic tapestry of these diseases, how they're also interrelated, and just to use the analogy, still interwoven.
Right.
And so patients will very often feel something, as you said, but maybe you can make some suggestions of what they should do if they aren't feeling quite themselves. Like, do they seek out now patients know they have MASLD and MASH, let's say. So do they go back to their liver doctor, or do they go to their primary care physician and say, I'm not feeling well, and maybe try to assign how they're feeling to another disease state?
Well, I think that it's a full assessment, right? So I think that if you have MASLD or MASH, you want to make sure your diabetes is well controlled. Let's eliminate that as a cause of the symptoms, right? Because if you have episodes where you have hyper or hypoglycemia, that can very much cause this kind of symptoms of fatigue and feeling unwell. So you want to make sure you want to process of elimination, right? So you want to make sure you're addressing all your issues. So one is your diabetes control. Have you been screened for hypothyroidism? If not, you need to be. You need to ask for a TSH and say, I want to make sure I'm not hypothyroid because that is it is a risk factor for MASLD and MASH. And it causes many of the symptoms that can be nonspecific, like general malaise and fatigue. And so you want to make sure that, like adrenal insufficiency, other things, you just want to make sure that all of the things that may have a very specific intervention are dealt with. Now, with MASLD and MASH, now that we have therapies, certainly it's our opportunity to tie the symptoms to the disease. So now we never had a treatment, right? So now if you go on a therapy and you say, well, my liver disease is improving. Are my symptoms improving? We need to try to establish causality. And the only way to do that is to treat what might be the driver. And if that is getting better, logic would predicate then that if the symptom is related to that, then the symptom should improve. And that's how, as we move the field forward, we can start to get causality and tie these things more specifically. I think what people have said it's a silent disease is that you some people might present with pretty advanced stages, right? And so they didn't know that some of these non-specific things could have been related to their liver, right? Because like I said, it could have been related. So that's what it is. It can be silent in many, but not in all. And I think that's the key.
Okay, so you've said if they're seeing a liver physician already, which they likely are, that's where they should start and maybe get direction from them. I wonder too if patients, because they are so related, also already know that they have type 2 diabetes, or they're self-aware about the struggles with obesity that they're having, that may give them some indication of what's causing some of their symptoms too, right?
Yeah, and I don't think it's going to necessarily be one thing, but it's the conglomerate of things that are synergistically contributing to those symptoms.
Okay. And what should they say to the doctor? I mean, it's easy for you. You're a physician, and but looking at it from the other perspective,
Yeah,
sometimes
it's hard.
people
It's
they're
hard.
afraid to go to the doctor. They don't want to complain. They don't want to take up the doctor's time. When they get to the office, they see a room full of other patients, and the last thing they want to do is, doctor, I've been feeling kind of tired lately, and afraid the doctor is going to make them feel, which we heard recently at a patient listening forum, a Madrigal sponsor, that they may feel stigmatized even because of that. And so how do we take away that guilt or fear for them, would you say?
Well, I think specifically if it's new symptom, that's very telling, right? So I think you want to say, lately, in other words,
That's good.
this is not something that's been like something like there's a change in my clinical situation. That should draw the attention of the physician that there has been a change and I need to look for what was the driver of that change. So if a patient said to me, I would look for thyroid disease, I would do those things, right? And then, of course, all you can do is maximize the management of the known conditions, right? And see how that helps. And as I said, if you have a therapy now for MASLD and MASH and you're eligible for that, the hope is that with the treatment, you will feel better. And then the doctor is also going to start to make that connection. This is new for us too because we haven't had treatments.
Right.
So how do we know until we can eliminate the driver or mitigate the driver? We also don't know what's attributable to the liver. But if I see, oh, this patient now is on therapy X, which is doing this, and their symptoms are improving. Now, even me as a physician, I'm saying, their symptoms were related to their liver disease. So we're learning too.
So I wonder, and this is how I'd like to wrap it up, is just to get this thought from you. Um, Patients very often will go in with a partner or caregiver. And should they or the patients themselves keep a log, maybe? We didn't talk about that at all, but is it important to sort of track how often, how severe, maybe rate them 1 to 10, that kind of thing?
Yeah, I think that's a great idea because that's tangible. And so, there may be, because if it's fluctuating, right? So when symptoms are fluctuating, it's like, what's different? If symptoms are kind of the same every day versus, gee, I feel worse, in the afternoon, I feel worse in the morning. There's things that could clue in, like adrenal insufficiency, for example, low cortisol levels at certain
Mhm.
times of the day. So I think it is important to understand. And then even if because then there could be strategies. At the end of the day, the goal is to make the patient feel better, right? And so if the strategy is, well, have a snack at this time, and let's see if that makes you feel better, because maybe something is, your sugar is low, what have you. Maybe if it's in the afternoon, you recommend, okay, let's try going for a walk for 30 minutes at 4 o'clock. Let's see if that helps because we need to, not everything will come down to a medicine. And some things might come down to, well, what are things that I can change to optimize my feeling of wellness, right? And so there's different things and the timing of the day could have an impact. I do want to make a comment of some more specific symptoms that could be liver related, though, that people
Sure.
should know about, because we hear a lot about right upper quadrant pain or fullness in my right upper quadrant. And so there, there is the possibility that the capsule is being stretched by steatosis in the liver. But again, let's see that, okay, now if you're on a medication that decreases the steatosis, does the symptom get better? We need to start to make these ties to intervention and symptom improvement, because if the symptom doesn't get better, then we can say, well, that wasn't what was causing it.
Right.
And so we need to start to do that. Now, itching is easy so if a patient is feeling pruritus, and I don't mean like the dry skin, like just in the winter you get it, but like you start to have hands and your palms and soles itching, there's tests, like you can look at serum bile acids to see if there's elevation in the bile acids, which is something related to the liver. And there's treatments that make you bind the bile acids and kind of poop them out so that they're not in the serum and causing the itching. So there are some things that can be assessed that could be more liver specific directly.
Okay, no, that's fantastic advice all in. And it really comes down to the fact we have to recognize every patient's an individual. So it's going to be a tailored approach. As a physician, you're never going to be able to say, just do this because you've heard it before. I think
Right.
you asked so many relevant questions, during this conversation that, hopefully they'll go to a physician that will do the same. And thank you so much, as always, for sharing your insights and your experience. And you're going to help a lot of people.
Oh, thank you for the opportunity.